They won't tell you this during a regular doctor's visit. But let me be honest. If you've stopped being physically intimate with yourself in your later years, your body may already be paying a quiet price. This isn't a joke or locker room talk. It's biology. And it affects your brain, heart, immunity, and even your sense of identity. Hi, I'm Dr. Fiona, urologist and men's health specialist. For over a decade, I've helped older adults rediscover strength, confidence, and connection through evidence-based lifestyle medicine. And one of the most silent issues I see is disconnection. People stop nurturing their sexual and hormonal health, but that natural rhythm was never meant to disappear. 1. The prostate and bladder connection. When you stop engaging the glands and muscles involved in sexual release, the prostate stagnates. It's a living organ that expands, contracts, and clears fluid. Without regular movement, that fluid thickens and irritates tissue, causing swelling, poor flow, and those constant nighttime bathroom trips. Over time, this can progress into BPH, benign prostatic hyperplasia, affecting nearly half of men over 60. Regular stimulation helps flush out that fluid, reducing inflammation and pressure. Research even shows men who ejaculate around 20 times per month have a lower risk of prostate problems. This isn't about lust. It's about function, comfort, and freedom. 2. The brain fog. Nobody mentions. Many men in their 60s and 70s say, "Doc, I just don't feel sharp anymore." Loss of sexual activity can quietly accelerate that decline. During arousal and release, your brain releases dopamine, serotonin, and oxytocin, the same chemicals that improve focus, creativity, and calm. They also lower cortisol, the stress hormone that damages brain cells. When this chemistry fades, thinking slows. You're not just getting older, you're understimulated. Re-engaging with your body helps reignite those neural pathways, sharpening attention, confidence, and drive. 3. Emotional flatness and mood decline. When we stop connecting with our own bodies, we lose one of nature's emotional regulators. Orgasm releases endorphins and oxytocin, natural antidepressants that lift mood and calm anxiety. Without them, emotional dullness creeps in. One widowed patient told me, "I don't feel anything anymore." After re-establishing gentle self-touch and routine, he said, "I feel like myself again." It wasn't about fantasy. It was about aliveness. Your body was designed to create its own balance. It just needs permission. 4. Heart health and circulation. Here's what many people miss. Intimacy is a cardiovascular event. During arousal, blood vessels dilate, nitric oxide levels rise, and heart rate strengthens in a controlled rhythm. Essentially, a micro-workout for the heart. When that system goes unused for months or years, circulation slows, blood pressure balance weakens, and tissues receive less oxygen. Regular, healthy sexual activity supports vascular flexibility, improves blood flow patterns, and can even lower resting blood pressure. So when you reconnect physically with your body, you're not only reviving pleasure, you're improving your heart health and longevity. 5. Sleep and recovery. Sleep isn't just rest, it's healing. During orgasm, your body releases oxytocin, prolactin, and endorphins, hormones that quiet the nervous system and promote deep rest. Without that switch, you're more likely to wake during the night or feel restless and unrefreshed. Better sleep rebuilds tissue, stabilizes hormones, and sharpens memory. Sometimes, one small biological rhythm can reset your entire circadian system. 6. Pelvic strength and stability. Your pelvic floor is the foundation of your core. During stimulation and release, those muscles contract rhythmically, improving tone, coordination, and circulation. When that movement stops, the muscles weaken, leading to leaks, strain, or reduced sensation. Think of it as physical therapy you can do privately. A strong pelvic floor protects your bladder, spine, and confidence. 7. Immune and hormonal resilience. Sexual stimulation boosts your immune system by increasing immunoglobulin A, an antibody that guards against infections. It also reduces inflammation through endorphin release. When this rhythm disappears, your recovery from illness slows, energy drops, and chronic fatigue can set in. Reactivating that process helps your body defend and repair itself naturally. 8. Identity and self-worth. Perhaps the most profound loss isn't physical at all. It's personal. I've had patients tell me, "I don't feel like I live in this body anymore." When you stop connecting physically, you begin to disconnect emotionally. You start seeing your body as something separate, even burdensome. But when you reconnect through touch, care, or mindful self-awareness, you reclaim ownership. You remember, this is still my body. I still matter. That moment of reconnection rebuilds dignity and self-esteem. Aging isn't disappearance, it's transformation. 9. Reclaiming connection and confidence. After working with thousands of older adults, I've seen the pattern. The greatest threat to vitality isn't disease, it's disconnection. When you stop caring for your body, it goes silent. When you begin again, with curiosity, movement, and attention, it wakes up. Circulation improves, hormones rebalance, mood lifts. Pleasure, in its healthiest form, is medicine. It's how nature keeps us whole. If this message resonated with you, please like, subscribe, and share this video. Tell me in the comments what age you're watching from. I truly love hearing your stories. Because no matter your age, your body still listens. It still wants to heal. And when you care for it, it always responds. Take care of yourself. I'm Dr. Fiona, wishing you strength, clarity, and a body that still feels like home.